Hey everyone, welcome back to my channel. I'm Dr. Stephen Grant, and today we're diving into something a little unexpected but genuinely fascinating. What if I told you that applying a simple natural oil to one specific area before bed could actually make a measurable difference in your bedroom performance? I know, that sounds like one of those too good to be true internet claims, but stay with me because this isn't gimmicky advice. It's backed by centuries of traditional use and real biological reasoning once you understand how it works. So let's talk honestly. After 50, a lot changes. Circulation slows, hormone levels shift, and tension builds in areas that used to be effortless. What we're discussing today is a natural, science-supported method that can help restore healthy blood flow, ease pelvic tension, and yes, promote stronger, more reliable erections while you sleep. And it's a lot simpler than you might think. Most doctors never discuss this, partly because it's outside the typical prescription-based approach. But as someone who's spent years studying men's urological health, I can tell you this: your body still has incredible capacity to repair itself, if you give it the right kind of support. Let's start with a truth most men never hear. Erections aren't only about testosterone. They depend on three key factors: blood flow, pelvic floor muscle tone, and nerve sensitivity. And here's the great news: each one of those can be improved at any age. You're not broken. You're simply not maintaining your system the way it deserves. Most guys think their choices are either taking a pill or just accepting decline. But there's this entire middle ground of natural approaches that actually work. And that's where this nighttime oil technique comes in. Now, why oil? It's not just about lubrication. As men age, the skin and underlying tissues in that area become thinner, more fragile, and drier. Every time you sit, move, or even exercise, there's subtle friction that over time creates irritation and low-grade inflammation, the silent enemies of good blood flow. A quality oil solves that in two ways. First, it forms a gentle protective barrier. Second, the right kind of oil can actually penetrate through the skin to reach the tissues beneath, encouraging circulation, calming inflammation, and relaxing tight pelvic muscles. It's like giving your body a focused therapeutic massage, but directly where blood flow matters most. Now, not all oils are created equal. The one I recommend most is castor oil, and here's why. Castor oil contains a rare fatty acid called ricinoleic acid that makes up about 90% of its composition. This compound has powerful anti-inflammatory properties and boosts local circulation. Unlike most oils, castor oil doesn't just sit on top of your skin, it actually seeps deeper, nourishing and stimulating the underlying tissue. That's a big deal for men over 50. You're essentially giving yourself a gentle circulation upgrade, right where it counts. It also supports the lymphatic system, helping reduce congestion and that heavy, swollen feeling many men experience with age. If you're allergic to castor oil or don't like the texture, you can try coconut oil, great absorption and natural antibacterial properties, or almond oil, loaded with vitamin E for tissue repair. But in my clinical experience, castor oil is the MVP here. Nothing beats it for circulation and comfort. You can find organic, cold-pressed castor oil in almost any pharmacy or health store for about $10. One bottle lasts months. Now let's get practical. Where do you apply it? There are two main zones that matter most. 1. Lower abdomen, the area just above where your penis attaches to your body. This lies over major blood vessels in the base of your pelvic muscles. A gentle massage here encourages flow and helps those muscles relax. 2. The perineum, the area between the scrotum and anus. Not a glamorous topic, I know, but this small region is pure gold. It's directly connected to the prostate, pelvic floor muscles, and key arteries that feed the penis. Gentle stimulation here can ease congestion and dramatically improve local circulation. Here's the step-by-step method. Warm about a teaspoon of castor oil between your palms. Cold oil down there is never pleasant. You can lie down or stand, whichever feels comfortable. Start with your lower abdomen using small circular motions for about a minute. Apply light, steady pressure, nothing painful. Then move to the perineum using 2 fingers to make small circles or short back and forth strokes for 2 or 3 minutes. The whole routine should take around 5 minutes total. You may feel gentle warmth or deep relaxation afterward. Both are good signs. That means blood flow is improving and those tight pelvic muscles are letting go. Now, timing matters. Doing this right before bed is ideal. During sleep, your body goes into deep repair mode. Testosterone production peaks, growth hormone rises, and your cardiovascular system relaxes. By priming circulation before you fall asleep, you're giving your body a head start. The oil keeps working through the night, supporting blood flow and tissue recovery while you rest. Many men notice stronger, more consistent morning erections within a week or 2. That's your body's natural feedback loop saying, "This is working." So how often should you do it? Start 3 nights a week. Say Monday, Wednesday, and Friday. Give it a full month and observe how you feel. If you notice improvement, maintain that rhythm or increase to every other night. If your skin becomes tender or overly sensitive, cut back. For most men, 3 to 4 times per week hits the sweet spot. Like the gym, consistency beats intensity. Results come from regular practice, not one-time effort. Now here's the bonus most guys don't expect. Beyond better erections, this routine often improves urinary flow, reduces nighttime bathroom trips, eases lower back tightness, and even enhances exercise performance. That's because the pelvic floor anchors your core. When it's healthy, your whole posture and movement improve. And let's be honest, when things work well down there, it shows in your confidence, your mood, and your overall energy. But let's keep this responsible. This is not a medical treatment for serious erectile dysfunction or heart disease. If you're experiencing chest pain during intimacy, blood in your urine, or severe symptoms, see your doctor first. If you're on blood thinners or have bleeding disorders, use extra caution or skip the massage entirely. And always maintain hygiene. Wash hands before and after, and never share your oil bottle. Also, set realistic expectations. This isn't an instant transformation. It's gradual progress that builds with time. Think of it as supporting your body's natural function, not forcing it. So, how do you make this a habit? Pair it with something you already do. Brushing your teeth, your evening skincare, whatever fits. Keep the oil visible on your nightstand. Out of sight really does mean out of mind. Set a gentle phone reminder for the first couple of weeks. And here's a tip from my patients. Warm the oil bottle in a cup of hot water for a minute before using. It feels luxurious and makes the routine genuinely enjoyable. Some couples even turn this into part of their bedtime intimacy. And that's perfectly fine. Whatever keeps you consistent. Remember, getting older doesn't mean giving up your vitality. Your body still wants to perform. It just needs your help maintaining the systems that make that possible. 5 minutes, 3 times a week. That's all it takes to start noticing changes in how you feel and function. It costs almost nothing, carries virtually no risk, and could improve not just your sexual health, but your comfort, sleep, and confidence too. So, give it a try for 30 days. Track your energy, your sleep, and yes, your morning strength. You may be surprised by how much difference such a simple habit can make. And if you find this helpful, share it with a friend who could use a little encouragement. I'm Dr. Stephen Grant, and this is the kind of real, practical men's health conversation we need more of. If you learned something today, hit subscribe, tap the bell, and join me next week for another evidence-based way to keep your body performing at its best, naturally.